straighten my tie. I'm not ready to go yet. Basically, everyone did such a wonderful job. Give them a hand. My name is Dr. Faheem Nasir, and I'm a chiropractic doctor of chiropractic. I received my first degree from Life University, so I'm a two-time alumnus, but I attended North Carolina A&T State University. After leaving there, I went to Life University, and I graduated in 2004. Got my license in 2005, and I've been practicing since that time. I went to Michigan, and I practiced there for a while. I'm licensed in 3 states. I got my license in Florida after I left Michigan. I practiced there for a while, and while I was practicing in Florida, I practiced here also. I will be going to Michigan next week to do for a meeting, and I'll probably be there for 3 days. But my goal is to basically take GNLD over to the nation, because the product is such a wonderful product. It, as the pharmacist, I can't remember, I don't want to mess up his last name, but he, to spin off on what he was saying, the products are so phenomenal. I had been working with a lot of different products when I went to Michigan. If you know anything about Michigan, they call it the five-hand state, or I forgot, the mid-state or whatever it is. But they are a lot of natural remedies and therapies and things like that they believe in. So it's easy for them to take on anything that's natural. And so with that in mind, I always had people coming in and giving me things and asking me to try this, and then I would proceed to try it myself before I gave it to my patient. I would do a lot of different types of things that were natural. And so in doing that, I found that GNLD, when I actually came to GNLD, found the product, my cousin brought it to me. She came down from Buffalo. I was here in Georgia. And she said to me, well, why don't you try this? And I said, well, I've tried a lot of different products. Everyone wants me to try these products. And I try them, and they seem to work, and they work a little bit, and some of them work better than others. But it never was a consistency where I could take it to someone and say, tomorrow you're probably going to feel better, most likely. In 3 hours, this is going to happen to you. And so I didn't have that consistency. And then a lot of patients, as you guys know, they do not want to comply with what your recommendations are. Then GNLD just seems perfect for with our busy lifestyles, perfect for what we're trying to do. So the things that I've received from using the products, for instance, my parents had high blood pressure. My mom was borderline diabetic, and she started to take the products. When my cousin brought them down, she said, here you go, take these products. And then we said, I told her, I said, well, I've tried everything. I'll try it because you're my cousin. Why not? So we gave them to her. She used them. My father used them. I took a couple of sips of Trey, and that was pretty good. And I noticed an effect on myself first, because the next day I had stayed up all night researching the product. I literally had stayed up all night, and they had invited me to a meeting the next day at 7 o'clock, or 7 o'clock that day. And so I didn't realize I had stayed up all night. It was actually 5 in the morning. I was getting off the computer, and I literally had stayed up all night, and I had a full day of work the day prior to when they came to visit. So I knew that if you're focused, one of the things on the tray, it says that you have clarity, mental clarity, you have, it's like 20 different things that it does. But that mental clarity, I tend to not have any ailments, which is great. But things that I noticed from taking that product versus taking something else, that they would say mental clarity that you would need, or something that was, that they'd say it is going to affect you in this way. I never experienced it. And so when I experienced that myself, I was like, wow, this product actually works. I took my mom and my dad. My dad never wants to get his blood pressure checked. He never wants to do anything. And so my mom took his blood pressure, and she said, wow, your blood pressure's high. So it was perfect that night. She took it, and then the next day when they took the blood pressure, my mom already chronically had the problem. So the next day they took the blood pressure, and both of their blood pressures were down, and my mom's was, it was always up there, and it would go back and forth unless she was taking, and then I would give her these other things, and it would help it, and then she'd take the medicine sometimes, and then she don't want to take the medicine, so because she always been natural her whole life, so she's having this dilemma in her head, and she's like, oh, I don't want to take the medicine, I'm taking the medicine, let me take a little pinch of it. So these types of things are occurring. So in a nutshell, the products work, because I don't want to go on and on, but the products work, and if you take the products, in my practice I use the products, and we actually, when the patient takes the product, they do what I tell them to do, they see results in a matter of a day to 3 days tops. And that's phenomenal. Because I've never seen any other product that I've used, and I've used a lot of them. I can name you tons of companies, but I've not seen another product do that, not one. And that's all I want to say. That's my time.